which STIs have long-term hidden effects. Imagine discovering years later that an infection you never knew you had has caused serious health problems. Many sexually transmitted infections can quietly cause damage long after the initial infection. Some of these effects are hidden and may not show symptoms right away, making regular screening essential. Chlamydia and gonorrhea are bacterial infections that often don't cause symptoms, especially in the early stages. If untreated, they can lead to pelvic inflammatory disease in people assigned female at birth. This condition causes inflammation and scarring of the uterus, fallopian tubes, and ovaries. The result can be chronic pelvic pain, infertility, and a higher chance of ectopic pregnancy, which can be life-threatening. In males, untreated infections can damage the testicles and cause scarring of the seminal ducts, leading to infertility. These infections also increase the risk of acquiring HIV because they damage mucous membranes, making it easier for the virus to enter the body. Syphilis is another STI that can hide in the body for years without obvious signs. If not treated, it can cause severe long-term health issues. These include blindness, neurological problems like dementia and stroke, hearing loss, and damage to vital organs. In pregnant women, untreated syphilis can lead to stillbirth, infant death, or congenital syphilis. Babies born with congenital syphilis may have long-lasting issues such as skin problems, bone deformities, vision and hearing loss, and nervous system damage. Early diagnosis and antibiotic treatment are crucial to prevent these outcomes. Human papillomavirus is a very common virus with many types. Some cause genital warts, but others are high-risk strains linked to cancers. Persistent infection with high-risk HPV types can lead to cervical, vaginal, vulvar, anal, penile, and oropharyngeal cancers. These cancers often develop years after the initial infection. Because HPV is usually asymptomatic, regular screening and vaccination are important preventive measures. Herpes simplex virus, especially type 2, causes genital herpes. Once infected, the virus stays in the body in a dormant state and can reactivate periodically. Long-term effects include recurrent painful sores, urinary issues, and in rare cases, meningitis or encephalitis, which is inflammation of the brain. Herpes also increases the risk of acquiring and transmitting HIV, adding to its long-term health impact. Hepatitis B and C are viral infections that target the liver. If they become chronic, they can lead to serious liver problems like cirrhosis, liver failure, and liver cancer over time. These viruses are transmissible through sexual contact and blood exposure, making prevention through vaccination and safe practices vital. Many STIs are silent, meaning they don't cause symptoms but can still cause damage. If left untreated, they can lead to pregnancy complications such as miscarriage, premature birth, and infections in newborns that have long-lasting effects. The stigma surrounding STIs often discourages open conversations and timely medical care, which can increase the risk of long-term damage. In summary, infections like chlamydia, gonorrhea, syphilis, HPV, herpes simplex virus, and hepatitis B and C can cause hidden, long-lasting health problems. These include infertility, cancer, neurological issues, and damage to vital organs. The best way to prevent these outcomes is through regular screening, practicing safe sex, getting vaccinated when available, and seeking prompt treatment. Always consult healthcare professionals for personalized advice and testing options to protect your long-term health.